Greetings, everyone. We are going to be starting in a few more minutes' time. We're just letting more people come into the room. Just sit back and relax for a while. Thanks, Hannah. Hello, everybody, and welcome and happy World AIDS Day. Welcome to our second Sustainable Business Research Cluster webinar 2021. This is the title called. Sorry, I'm having some feedback. Sorry, I think it's me. Let me just check what's my feedback. Yeah. I fixed it already. Okay, so let me begin again. Happy World AIDS and welcome to our second sustainable business research cluster webinar number 2, 2021. And this is entitled The Hidden Pandemic Facing Hidden Populations, HIV and AIDS in Malaysia. And just a little bit of background, the Sustainable Business Research Cluster is led by Professor Susila Devi and Professor Yuga Fujimoto of the Sunway University Business School. And we are one of the research clusters dedicated to engage in research that will create immediate and sustainable, lasting positive impact for businesses, environment, and also society. So in line with what we're trying to do in terms of Sunway Group's vision, our research cluster embraces the focality of the UN Sustainable Development Goals, and we're trying to extend our research goals that will include meeting the triple bottom line sustainability of meeting prosperity for people, profit, and planet. So hence, with this in mind, one of our projects includes researching the various mechanisms that will improve the support systems of the marginalized and the disenfranchised communities, which of course includes the PL-HIV, the people living with HIV/AIDS. So I'm thrilled to have Mr. Raymond Tai, Acting Chief Operation Officer from PT Foundation with us today. And of course, I think Raymond will share with you a little bit about what PT does and also this history. And I hope that today's discussion will be a very, very uh, uh, beneficial one to everyone. And we just would like everybody to keep your mics off. Make sure that you remember that this is a safe space so that if you have any questions, you can either direct it to us anonymously through our link, which our co-host is going to give it to you on the chat later on, or we can save until the Q&A until the end of the presentation by Mr. Raymond Tai. So thank you everybody for being here. Raymond, please take it away.
Hi, good evening, everyone. Can you hear me loud and clear?
Yes, yes, we can hear you loud and clear. I can hear you loud and clear.
Okay, and happy World AIDS Day to everyone. It's the 1st of December. It's celebrated all around the world on 1st of December, an event to create as much awareness on HIV and AIDS around the globe. And in Malaysia, we always host a lot of events during the month of December, and we're very happy to be part of this event with Sunway University Marketing Students Group and the Sustainable Development Department on this thing here. So very happy to be here. Yeah, it's a nice small group, 15 people. I kind of like small groups because we can do more discussions around that. But at the same time, if there's more people listening to it, we much welcome that. So I have some slides to present. So I will, and some interesting videos to share. So bear with me. I think the session will be about 30 minutes, and we will try to leave time for question and answers, because that's the best part, to actually be able to engage each other, even though it's not physical, but at least virtually. Yeah. So just give me a second while I get my steps, my startup done. Wait. Oops. Hang on. Okay, you see my screen now on the first page?
Yes, Raymond.
Okay, cool. So the topic I've been asked to speak on is titled "The Hidden Pandemic Facing Hidden Populations, HIV/AIDS in Malaysia." So that keyword here is about hidden and pandemic, because the word pandemic is very popular today because the whole world is going through COVID-19. Hidden because there is another pandemic that's been around much longer, for the last 40 years, and that's the HIV/AIDS pandemic that has swept the world for 40 years, and we are still in the midst of this pandemic. So good luck to COVID-19. I have presented some facts here that I thought is quite interesting to look at between COVID-19 and AIDS. Of course, the virus for COVID-19 is SARS-CoV-2, and the virus for AIDS is HIV. And if you look at the first recorded case, I put there recorded because there is a lot of controversy about when the first case actually is. But the first recorded case is, of course, in Wuhan, China in December 2019. Now, interestingly, the first recorded case for HIV/AIDS was previously said to be 1981 in Los Angeles, when air steward developed HIV, and the disease spread rapidly. But we know today, after many years of decades of research, that HIV actually started much earlier in the 1950s, but nobody knew that there was HIV then. There was only in 1981, when it became an epidemic among the gay community there, that it was first given its name as a gay immune deficiency syndrome. Eventually became known as AIDS. So similarly for COVID-19, that would be the situation that I think people are already finding out that COVID-19 has been around much earlier than December 2019. So it'll be interesting to watch what happens next. But from then on, you will see that it spread very quickly for COVID-19, 260 million in last count. For HIV/AIDS, there has already been 80 million, but it's over 40 years. Yeah, and out of the 80 million, 38 million are still living. If you look at death rates, 5 million in less than 2 years. But for HIV/AIDS, 37 million people have already died of HIV, of AIDS. Yeah. And how is COVID-19 spread? or the virus rather, is spread through respiratory droplets in the air and surfaces, whereas for HIV it's a lot more limited. It is either through sexual contact or through injecting drug users sharing needles, through blood, semen, vaginal fluid, and breast milk. You cannot get it any other way except through these bodily fluids. Fatality rate for COVID-19 is at 2.4%. That's also disputable depending on how the figures are reported. In Malaysia, that figure is actually less than 0.2%. But for HIV, if you don't get treatment, all of them will surely 100% will die. That's how tragic. That's why you get in a 37 million. That figure there, most of them died before treatment was available. If you look at symptoms, so we know that COVID-19, most do not show symptoms. If they do show symptoms, it will show up in 5 days. But with HIV, the dangerous thing here is that it's really hidden because you do not know that you have HIV until you get full-blown AIDS in many cases. So the only way for you to know is to actually get tested regularly. So, and of course, for COVID-19, there is no cure yet. There are many efforts to try to get a cure. But if HIV is any benchmark, 40 years, and there's still no cure for HIV and AIDS. Treatment for COVID-19, there is none at the moment. There are a few that are in the pipeline, but none seem to be highly effective. But the amazing thing about HIV is that today we have treatment that is highly effective so that people with HIV can live very normal lives. In fact, at last time, there are more than 24 antiretroviral drugs that has been approved for treatment. In terms of prevention, it is possible for COVID-19, but it is quite restrictive with face masks and with physical distancing and all that. But the treatment for HIV, it is the prevention is highly effective because all you need is minor adjustments to how you have sex and how you inject needles, and that's actually very effective, but easier said than done. Up to now, transmission is going around because people are still not practicing prevention. If we look at vaccines for COVID-19, there are already more than 7 vaccines approved by WHO in less than a year. But in HIV/AIDS, no vaccines yet after 40 years. I listed the last two. One is degree of paranoia. It's very high, but declining with COVID-19. Of course, when the moment somebody got COVID-19, there is a big hoo-ha about it. It's the same with HIV/AIDS, except that 40 years later, it's still very high. You know, it's a moment you know about a celebrity or a politician get HIV, it's considered as, wow, oh my God, what's happening, right? So interesting to note that 40 years, the paranoia is still quite high. Stigma and discrimination, that's, I think, one of the most critical factors whereby the difference is. For COVID-19, if you do get COVID-19, you actually get a lot of empathy and healthcare and everything is provided for free and everything. That's not the case for HIV and AIDS. From the early times, there was no treatment and people with HIV and AIDS were really shunned, isolated, were really lose their jobs, their family, and everything. So I've been working on HIV/AIDS in Malaysia for more than 30 years. And during the time in the 1980s and 1990s, when I was out on the streets doing the work, there was no treatment. And the main thing that we could do is to actually provide counseling, support, and acceptance to allow people with HIV who would eventually get AIDS to die with dignity. Nobody else, not even close friends, family were visiting them, and we were only visiting them at that time. Today, the situation is quite different, but the stigma and discrimination is still high. There are still laws stigmatizing and discriminating against people with HIV. So that, I think, sets the platform for the discussion today. Two different pandemics. One is very open. HIV/AIDS is much longer, but it's still a hidden epidemic and pandemic around the world. So with that, let's look at where we are with HIV around the world. Just focusing on the red line and the dark blue line at the bottom, you will find that since 1990 to date now, HIV has actually been on the decline for more than more than 20 years already, it's been on a decline globally, right? So that the number of people living with HIV is actually on the rise. The reason that it's on the rise is because there are people living with HIV is living, they're not dying anymore because of treatment, right? So that's the picture to look in terms of global. But I want to zoom in straight to Malaysia now. You find that's a rather different picture here. Yes, we have a decline in rates from 2002 onwards, but you find that the decline has plateaued out from 2010 onwards. It's just remained stagnant, right? At the peak, we were getting about 7,000 new infections every year, but today we're still getting a stubborn 3,000 over infections on an every year basis. So is it something that we as a country or as is something to be happy about? I don't think so, especially when you look into what's happening by looking at different modes of transmission, and you see a very different picture there. But before that, just a quick snapshot about the HIV doesn't affect everyone equally. It's in Malaysia, it's men that are getting more HIV than women. The gap is closing now. It used to be 1 out of every 10 is women. Today it's about 2 out of every 10 or 3 out of every 10 is a woman, right? Which actually goes in line with the way the HIV has moved along in Malaysia. It's no longer so much to do to injecting drugs. It's mostly to do with sexual transmission. If you look into the age group as well, you find that HIV has been a real security issue for the whole world, in Malaysia included, because it affects mostly the most productive age group of 20 to 39 years old. 76% of those who are HIV positive are in this age group, and they are the ones that are the engine of growth in any country, right? In countries like Africa, where 25 to 30% of the population is already HIV positive, you find that there's a whole generation of productive workers left, parents are left, died, and children are looked after by the grandparents. But this chart to me is, again, the reason why I've chosen the topic about the hidden population and the hidden pandemic, because if you look very carefully, this mirrors what the earlier chart is showing for the HIV transmission rate in Malaysia from 2005 to 2018. The light blue line is injecting drugs transmission, and the red line is sexual transmission. So you can see that in 2005, 8 out of 10 new HIV new infections were due to injecting drug users. And that figure has been declining, so that in the graph here 2018, but I know that in 2020, that figure of injecting drug users has dropped to just 1% of those who are HIV positive got AIDS through sharing needles, contaminated needles to drug users. But sexual transmission has been on the rise ever since 2009, and it's still going up. So that's the scary part. And it's not hitting everyone equally as well. You find that it is very much a disease that is affecting key affected populations that are marginalized, that are stigmatized. The more stigmatized, the more invisible the population is, the higher the infection rate would be. So that when you look in 2018, the ratio of homosexual, bisexual to heterosexual is almost 6 out of every 10 sexual transmission cases due to homosexual transmission. So that's really high and affecting homosexuals, transgender women, as well as bisexual a lot more significantly. This is a chart from the Ministry of Health showing the study from what they do every 2 years. They do an integrated biobehavioral surveillance study. It's a study whereby they sample key affected populations to see where the prevalence rate is in the population. So you've got 4 groups here. FSW is female sex workers, TG is transgender, MSM is men who have sex with men, and PWI is people who inject. See that of the four populations is the MSM one, whereby the prevalence has shot high to a high of 21.6% in 2017, right? That actually means that 2 out of every 10 men who have sex with men, according to this study, is already HIV positive. If you compare that to the national population, the figure is less than 0.5% of the national population are HIV positive. And that figure is declining for the national population, but among MSM is actually going very high. So that's, to us, is the crux of the issue in HIV, and that's why you're not getting a lot of public awareness campaigns and public health information or campaigns around HIV and AIDS, because it's an old disease. It's been around for a long time. It's on a decline. It only affects certain populations that is of not interest to the mainstream population. But that's actually a very dangerous way to look at it, because if you do not control HIV, what I call this are the gateway to the main population. If these populations, HIV is not controlled, it will eventually spread to the mainstream, as is the case in African and many African countries, whereby the HIV prevalence in the main population is as high as 30%. Yeah. So how and why is this happening to the homosexual population or the bisexual population? Is actually very clear when you look into the policies that the government has done. If you go back to a few charts here, this chart here that's showing the reduction in injecting drug users, there is something that the government was doing from 2005 onwards that is driving the transmission rate down. In 2005, the Ministry of Health, together with the Ministry of Home Affairs, decided that we cannot live with that kind of high HIV rates in the country anymore. And they went around to look into HIV in a very scientific, evidence-based way to look at what do we need to do to bring down the rate of infection among injecting drug users. They came up with a plan that the NGOs has been advocating for a very long time, which is that the way to attack HIV among injecting drug users is not to label them and discriminate against them. If some of you are older, you might remember the earlier campaigns has the tagline "Dada itu najis." That's how they were looking at making drugs considered as like the scourge of society, but that didn't work at all. So in 2005, they did a very brave, bold campaign that even the world is talking about it today, which is that they work with the NGOs to provide clean needles to every drug user on the street. They couldn't do it themselves, but they appointed, they collaborated with NGOs like ourselves to give out these clean needles. And we ran on a massive drive. Every year we distributed tens of thousands of needles, and that eventually drive transmission rate down. Not only did they provide clean needles, they also didn't just lock up all drug users and let them rot in hell or rot in prison, or in the past as well, if they say they want to give them rehabilitation, they put them as a cold turkey treatment, and they just sort of like put them in a camp, wake them up early morning, cold showers, and then they stop the addiction in 6 months. When they come back to society, within a few months, they get addiction again. So that all that practices have stopped, and what they introduced is another very bold, courageous project, which is methadone exchange program. They enrolled the clinics to give out this medication, which is like a cough syrup. Every day, you see drug users queuing up in clinics whereby they just drink this potent lotion every day, and that actually keeps them away from addiction to heroin. And together with these two reasons, that's why HIV rates among injecting drug users have declined. Now, the reverse is true for sexual transmission. We know that for sexual transmission, when was the last time you actually have a sound sex education in schools? None, right? And of course, the Malaysia has been going on a moral crusade since the 1990s. It peaked in 2000, whereby we sort of talk about Asian values and rejecting Western decadent values. And we started to really clamp down on LGBT communities. We implemented laws. Both we made the sodomy law in Malaysia much stricter. We introduced Sharia laws to actually prohibit people from even expressing themselves as bisexual, homosexual, lesbian, or transgender. There are laws in Sharia that is against it as well. And they went on this whole drive. And of course, in recent cases, you heard about the Noor Sajak case, whereby they hunt her down. About 2 years ago, you hear of this group of people, gay men who were arrested in different stages of undress in a condominium for having a sex orgy, and they actually paraded them naked and all that, and they charged them in court. So all these things actually drive these populations underground. Instead of providing them with proper education about how to prevent, there are effective prevention methods today. Instead of doing all of that, the government did a total opposite to that, which is they try to persecute these communities. And what happens is that they drive them underground, and we can't reach them anymore, right? It was so ridiculous that at some point in our outreach program, that we would be giving out condoms in Chowkit to sex workers in the back lanes of Chowkit at 6 p.m. in the evening. Our outreach workers will go out and give out condoms, and then at 10 p.m. at night, these vans will come from Jakim, from police, from DPKL, and they go around raiding these places, and they use the condoms that we gave them. The condoms are supplied by the Ministry of Health. They were sponsored for by the Ministry of Health. They use those condoms as evidence to say you are doing something that is immoral, so this is good evidence for us to take you in. Similarly, when we're doing this work in saunas, there are gay saunas where gay men go to have sex with each other, consensual sex. So we go to these places and we give condoms to these places, and the premise owners were very happy to receive them because they want to be providing responsible, they want the practices to be practicing responsible prevention methods. So they accepted the condoms we gave them. But when the police start raiding these places and holding out these condoms to say this is evidence that this place is not really a sauna, it is used for sexual purpose, in this case, immoral gay sex, they actually use that to charge them. And because of that, all the saunas stopped receiving condoms from us. And how many of these people, of the patrons eventually got HIV? We don't know, right? But those are exactly the things that is fueling the HIV epidemic, all right? So if there's nothing else you hear from this episode, I'm spending a lot of time to talk about this because I think most of you, I assume, are students, and you are going to be the leaders of tomorrow, and you might be studying something like medicine or public health. That you need to, I think the first thing that you need to be able to do is to push aside your own morality. I'm not asking you to abandon your own values. I'm asking you to not impose your values onto the public or onto key populations when you do something like a public health campaign. That would never work, right? Instead, you should look at evidence, you look at what works, and you implement that. So these methods of prevention that we're talking about have been proven around the world to work. So why would Malaysia be any different? Why would Malaysia then decided that they would go on a moral crusade and hope that would bring things down? It's crazy, right? But that's exactly what is happening even till today. Okay, let me move on. So the good thing is that the Ministry of Health has been a very collaborative partner with us, and they also abide by the targets set by WHO. So WHO actually have announced back in 2015 that today, with the new discoveries of medication and prevention methods, the world can actually end AIDS by 2030. But in order to do that, all countries need to be doing three things well. One is they need to test everybody who are HIV positive, so that if they are HIV positive, they know their status. So that's the target set is 95%. They also set a target for those who are HIV positive, that 95% of them should be receiving ART. ART is antiretroviral treatment, which is this wonder drugs. You take one pill a day and you will keep HIV away. Sorry, you take one pill a day and it will suppress the HIV from in your body and push so that your immune system is maintained. So that's what they want every country to do, providing treatment. And of course, if you are on treatment, you need to take the treatment every day for the rest of your life so that you can attain viral suppression. And if 95% of the people who are HIV in that country are on viral suppression, automatically by doing all these three things, it will stop transmission in the country and HIV will eventually end. Those people who are living HIV will eventually die of old age. And they will not transmit the virus and the world will be rid of HIV. These are very implementable practical steps, but it needs a lot of cooperation from governments around the world, and obviously poorer countries cannot afford to do that. Countries that have very poor healthcare systems cannot afford to do that. And of course, countries that use religion and morality as their way to do things might not agree to doing this. So that's why although these targets are very realistic and doable, but many countries don't. So if you look at how Malaysia fared in these targets, this is the targets that the Ministry of Health has announced to us. Sometime middle of 2021, we had a review and this was presented to us. So on the first 95%, we did quite well at 87%. So they claim that from the studies, 87% of those who are HIV positive know the status. But look at the second 50, second 90, right? Only 58% of those who are positive are linked to treatment. So the big question they've asked is, why is that the case? All right. So you look down the list there, it's due to things like enforcement, building trust, sustainability, accessibility, affordability, and the one in red, stigma and discrimination. To us, that is what is stopping a lot of people from using the clinics to go for treatment. Because first of all, they feel if they're going to be treated as a criminal by the government, why would they go forward for treatment, right? So the first thing that has to happen is actually decriminalize, but that's not going to happen in Malaysia. So that second 90% has to be addressed seriously. The third 90%, this is a credit to our healthcare system. The moment they are actually on treatment and they find that where they're on treatment at the clinic, the staff are not stigmatizing, are not discriminating against them, and they will not be pulled out and arrested, that sort of thing, they continue to go on treatment. So we have a good track record on that one. It's currently at 85%. Another 10%, we should hit a 95% mark. I want to show you here, these are figures that we pluck out. Also, these are figures from the Ministry of Health. And it's actually showing you what is happening among the gay men who have sex with men population in Malaysia. You can see how that figure has been climbing up all the way to 2020. The figure is around 1,900. So it is alarming. It's a tenfold increase over the years. If this is happening to any other populations, political parties, medical field, religious people will be shouting and banging tables about how can this be happening. This kind of alarming trend should never really be happening, but it is happening with the gay man population. Okay, Derek has asked me to now just maybe go through, I've identified what are the issues that we face, but how is PT Foundation making a difference to this year? So maybe a bit about PT Foundation is that our previous name is called Pink Triangle. We are a community-based organization that was established as early back in 1987. We are the first NGO that is doing this work. Like I said just now, when we started off, our intention was only to really provide dignity, support, empathy to those who are HIV positive, because it's a question of time before they die of HIV. But over the years, treatment has been discovered, and our focus today is not just about providing uh, uh, support, but more importantly, to provide prevention information and to bring people into testing and into treatment. I will go through that in these following charts. So in a nutshell, if we look into this diagram here, this is what we do at PT Foundation. We identify through our peer outreach and testing program called Joan Test, key populations like men or sex men, bring them, get them the information so that they can assess their own risk. And those who feel that they are having risky behavior in their lives, such as having sex without using a condom, they need to go for testing. So the next step is to actually provide testing. And we have established a community care healthcare clinic to be able to provide testing to everyone who wants it. And this testing is also available in all clinics in Seattle for free as well. So there is really no reason why anyone who is sexually active do not go for regular testing. Right? And the third circle you see there is access to treatment and adherence, so that everyone who tests negative, test positive, should really be going to treatment, so that they become the viral, the HIV is suppressed and they achieve virally undetectable status. And the last, and the one that is keeping them adherence is the fourth bubble, which is care and support. Remember, this is a drug that you're going to take for the rest of your life. So if the person's own psyche and welfare is not taken care of, many stop treatment because of that, maybe due to an episode of they lose their job, they go into depression, they start taking recreational drugs. These are very common issues. So we have to continue to provide care and support to make sure that they continue to be on treatment. So this are some of the programs that we provide, and I'm going to show you some photos of some of these programs that we do. First of all, the reason why we're so successful is because we are community-based. Our staff and our volunteers are mainly from the communities that we work with. So they are non-judgmental, community-centered, open and transparent, innovative, and we embrace diversity and inclusivity. So we are diverse in terms of race, ethnicity, religion, language, different qualifications, sexual orientation, gender identity. Everybody is treated equally in PT Foundation. This is our strategic, our vision mission statement. As I mentioned, it's all focusing around HIV and sexual health. But a big part of what we do is to really provide empowerment. We don't talk down to the community. We work with them and meet their needs, especially the psychosocial and other empowerment needs. So maybe to break up some of what I've been talking about, I want to maybe show you some of the advocacy work that we do. And you'll find that this is not your regular TV1 or TV2 government propaganda what they call advocacy campaign. But we make our videos very entertaining so that it actually connects and talks to the people you want to talk to. So this clip is called Sexually Transmitted Dating, and I'd just like to watch it. Okay. Unfortunately, I cannot see whether you guys are watching it, whether you're laughing or whatever. I hope it brings a smile to your face. And that's our intention here, is to make what we call edutainment. Education campaigns should be entertaining and relevant to the communities that are receiving it. I want to go straight into then this very exciting program that we have, which is called our Jom Test program. It's a program that is run by gay men for gay men. We have a team of outreach workers, 6 of them, and they are online every day, as well as in gay venues, to talk to gay men and to make them understand what is HIV and how, whether what kind of sexual practices they adopt, how to keep it safe, and then bring in for testing. So we had huge success. For every person that we speak to, at least 50 to 80% of them eventually go for HIV testing. So it's all very much online program. We have a young team who come over. We're on Instagram, on Facebook, on Twitter, and that's the message that we're trying to bring across. These are some of the banners that you will see on our social media. They're vibrant. They look. Hopefully, they look inviting. Yeah. So this is announcing the different times that we provide community-based testing. So our outreach workers are trained to provide community-based testing, whereby we actually bring this test to different venues. It could be in Shala, in Klang, in Kuala Lumpur, in Bukit Bintang. And we set a time and we're there and we do the testing. It comes with counseling, psychosocial support, and if they're positive, we then refer them for treatment, accompany them, and we assure them about confidentiality, privacy, that sort of thing. That's the team that is doing the work, and you can see they are having a lot of fun doing it. The top right corner is during, all these are done during COVID-19 time, so it became a lot more restrictive. Everyone that use a mask, we've got to practice social distancing and that sort of thing. These are some of the posters that goes out as well. They are erotic in order for us. So these are the ones that we go into gay dating apps and all kinds of social media marketing. And of course, whenever we do that, we'll always provide condoms, because condoms are still the best protection to HIV and AIDS. We do talk about abstinence and we do talk about monogamy, but when you are in a population of MSM or gay men, a lot of those options are not practical. If we're talking to female sex workers, how can you talk about abstinence or monogamy? So condoms for key populations is a definite must, and we spend a lot of time providing condoms and to educate people how to use condoms. However, the one that is a lot of people are still not aware of, because government hasn't done any public health campaign on this, is this prevention drug called PrEP, or pre-exposure prophylaxis. So pre-exposure prophylaxis is a drug that you take once a day, a pill that you take once a day, and you will be able to protect yourself from HIV. Even if you have sex with somebody who say you're HIV positive and you don't use condom, you cannot get HIV by taking PrEP every day. That prevents you. So it is the one thing that has really stopped infection rates in everywhere, in UK, in US, in Australia, even in Singapore and Thailand and Taiwan is seeing this happening. But in Malaysia, the word is not getting out yet. And also the critical factor here is that in those countries, PrEP is provided for free, at least in Australia and UK and all those things. But in Malaysia, it's not provided under the Ministry of Health for free. They have to get it privately. And if you go to a private GP, there are only a few that provide it, and they charge up to 250 ringgit, 400 ringgit per month for a supply of PrEP. We try to make it cheap and affordable for people by charging only 90 ringgit per bottle. That makes it a lot more affordable, but because we have to buy them off drug companies, so there is a cost to it. So it's the cost that is actually preventing people from getting the pill and that's causing the HIV infection rate, and that's causing unnecessary deaths in the country. This is how Thailand is approaching it. That's the way to go, but we will not be allowed to do a lot of these visuals in Malaysia. So the key message we want to tell people that if you want to be in control of your own life and your own health, you have PrEP is the best way to do that, because even when you use condom, it really depends on the other party to either allow you to use condom or for them to use condom. So there is a lot of power dynamics at play. But with PrEP, if you take it before every day, you take it so your partner that you have sex with doesn't even know that you already taken PrEP, right? It's not important. The thing is that you are protecting yourself. That's the one that's important. You're in control. Another great service that we provide is the community healthcare clinic. It's located in Sentul, near to the railway station. And if you can see, it's a beautiful place. A lot of counseling rooms and medical treatment rooms. Most of the treatments, the center is open Tuesday to Saturday. We have local doctors coming, but it's mostly community run, meaning that we don't depend on the doctors. Our community staff are trained to provide information, counseling, and even drawing blood for tests, providing injections, that sort of thing, and the doctor comes only when necessary. The process we use at the clinic is simple. It's about providing prevention, testing, linking them to treatment adherence, what we've been talking about. All right, some aspects of the services that we provide at the clinic. And here I will just bring in another video to show you how to promote our HIV testing services at CUCC.
Takut ke? Alah, naik je lah.
Hai, selamat datang ke CUCC. Tak perlulah, tak perlu.
OMG, tak payah IC lah. Ni ke ujian tambah nama. Mana baju kau? Panas lah, babe. Pakailah, nanti orang lain pandang nanti. Jangan rosak kertas tu.
15039.
Kau buat apa kat sini? Ni private lah.
Ini private counselling, hanya kita berdua. So, don't worry, this is a safe space, ya.
Tahu tak apa-apa pasal benda period HIV dan syphilis? Tak, okay.
Pernah tak lakukan apa-apa aktiviti berisiko seperti seks tanpa kondom?
Okay, it's fine. Sekarang saya akan cucuk jari awak dengan jarum yang kecil ni. Jangan risau, dia rasa macam kena gigit semua je, okay? Itu saja. Sekarang boleh tunggu sebentar untuk pesan ujian. Jangan lupa sarung kondom. Ada juga PrEP.
Kau rasa pregnant ke tak? Just joking.
Number 15039.
Kan senang jatuh? Jangan lupa tes lagi lepas 3 bulan. I dah tes. Jom tes.
Okay, so that promotes the clinic, and that service is available for anyone who wants to contact us. You can contact us by going online on our Facebook and on our website. Last service in here that I just want to quickly touch upon is the part about care and support. It's called MSM POS. And it's a peer support program for gay men who are living with HIV. And the people who are providing that support are gay men who are HIV positive themselves, who are really empowered and have been taking treatment for a while. And they're able to provide a lot of encouragement, because people first find out that they're HIV positive, all they can think about is that they're going to die, how they're going to live through it. But to have somebody like a peer who is empowered, positive, and already undetectable speaking to them, it's very affirmative and very empowering. So the MSM POS program provide a hospital outreach program. We are actually located in main hospitals like Hospital Ampang, Hospital KKL, Hospital KL, Sungai Buloh, and we work with the government doctors there and the counselors and the nurses there to provide another layer of support to people who are HIV positive. The counselors and the nurses will refer them to us, and we would take care of their welfare, especially in other areas. A lot of people don't realize that when you are HIV positive, you suddenly face insurmountable problems. Many of them, if it is because as a result of the company requiring a test, and if the company knows that they're HIV positive, they lose their jobs. Sometimes they're in universities applying for a job, and when they find a HIV positive, they lose their place in university. None of this are, of course, necessary, and in fact, it's actually against the human rights in most countries, but in Malaysia, a lot of that is happening at the moment. And then, of course, there's another layer about some of them have wives who they don't know how they're going to tell their wives. In Malaysia, HIV is a notifiable disease, so you have to inform your spouse. So how they're going to inform why suddenly if they inform their wife, they will probably lead to a divorce, because the wife will say, how the hell did you get HIV, right? Similarly, if you are an 18-year-old living at home and HIV positive, you will have to tell your parents, and most of them, if they are gay, they are not outed themselves to the parents yet, so they have this double jeopardy about how to tell them they're HIV positive and they're gay at the same time. So because of all these issues here, we have a team of people at MSM POS who can provide the counseling, the drop-in center. We have a support circle that provide help to them. And we try to be with them every step of the way until they are untransmittable. So that's the other thing that a lot of people don't realize, is that people who are on treatment, they will reach the stage that's called undetectable. And when they're undetectable, even if they have sex without a condom, they cannot pass the virus to somebody else, right? And people who are married in a relationship, the partner could be negative. They could still have sex with each other without a condom and have children, healthy children who turn out to be negative. So all this information is provided in a safe space in our MSM POS program. These are some of the activities that we do. It's a lot of it is providing them a circle of friends who become lifelong friends through outings, through information sessions, through a lot of workshops and participative sessions that we do with them. These are some of the hospitals and clinics that we work with. The doctors there are quite amazing, and they work very closely with us, so that we within ourselves, we really try to drive down. There's no stigma, no discrimination, and we have a very good working relationship with them. That's the last of my chart in there. It's taken a little bit more time, but I want to leave some time for question and answers. So thanks for listening in, and just, a big shout out to the Ministry of Health Malaysia, Malaysian AIDS Council, and all the staff and volunteers of the team. All right, I'm stop sharing now.
Okay, thanks, Raymond, for that sharing. Hannah, if you can put up the anonymous link for questions. We're going to open up into a time of question and answer. Of course, I have one question first, definitely, since I'm moderating the session. But for those of you who would like to ask a question, you can do it either by raising your hand, and if you want to do it live, please unmute yourself, and you want to show your picture or your video, that would be great, so that you can identify who you are, where you work, and then you can ask the question to Raymond. Or the link that we just gave you, if you want to ask a question anonymously, please also do so, because we will not be able to identify who asked the question. All right. So Raymond, thank you so much for that sharing. In fact, remember, I wanted to mention to you that I know you since I was in school.
That's how long we've been doing it.
That's
Crazy.
how long we've been doing it. Yes, yes, that's how long we've been doing this. And I guess I have seen over the course of 30 years, there's so much changes in terms of the work that has been done. And I do have to agree with you that the work has been stifled somewhat due to the changes in the political scene and also the social aspect of it all. I mean, I won't go into details, but I think you shared it quite well just now. And it was rather a no holds bar sharing just now when you mentioned about the changes. Yeah. There is one question that I do want to ask you, and that's basically asking you about the efforts of the MOH, because I noticed that I know that everything is all about COVID for the past few years, right? But shouldn't HIV also be given some sort of center stage, you know? Because if I mean, because the HIV has not been talked about for so long, that's why you notice that infection rates are going up. So do you know of any other countries or any best practices of any other countries that you know of that is doing a very good work in balancing the messaging behind COVID as well as HIV? That's my question. And what are they doing?
Okay, so there's a lot of questions you thrown in here. Why don't divide it into two, pre-COVID and post-COVID? Yeah. So pre-COVID, like I was alluding to earlier in my talk, we have an amazing partnership with the Ministry of Health, right? When people talk about the Malaysian government, they need to realize that there are many layers of the government and different ministries as well. So the Ministry of Health has a very different philosophy and approach than the Ministry of Home Affairs, where JAKIM and the police is under, for example. So a lot of the enforcement, the raids happen because of the Ministry of Home Affairs and the Ministry of Religious Affairs, all right? But the Ministry of Health, in everything that we do, they try to adhere to an evidence-based programming, but they are staffed by people who are Malaysians as well. And a lot of these people, because of the way they are raised and the way they've been indoctrinated, see the key population that we work with as immoral people. And in their mind, they're thinking that they deserve this because they are immoral. So that's the inter conversation, so that stigma discrimination is there. And that's where we have been working very hard with the Ministry of Health to provide desensitization program. We can't do it for everyone in the hospital, in the government ministry, in the hospital and nurses, but we can handpick selected clinics to work with. In Malaysia, there's about 50 clinics that have been sensitized, and when they go to these clinics, we get an amazing collaboration with them. Yeah. Similarly, there are all this talk about going on totally avoid homosexual sex, that sort of thing. That conversation does not happen in a Ministry of Health level when they see the doctor and the nurses. It sometimes happens, and when that happens, we complain it to the authorities, and it was immediately clamped down, right? So in that way, they've been pretty good. And also the fact that although medication treatment wasn't free, and back in the 1990s, when treatment was available, a person with HIV have to spend up to 1,000 to 3,000 ringgit per month
Wow.
on treatment
Wow.
because the government wasn't providing for free.
Right.
But
right.
since 2006, they started providing for free. By 2010, they are providing free treatment. So that's amazing. That's amazing support. So in that sense, I think the Ministry of Health has approached HIV/AIDS a lot better than they approach a lot of other diseases, right? But we know that in the Ministry of Health, resources are limited, and a lot of the focus now is on non-communicable diseases instead of infectious diseases. Until COVID-19 came along, and that totally distracted a lot of things resources-wise, and all our outreach work stopped. The testing programs in the clinics also stopped, and we now that it's lifted, we are going back again. But we find that a lot of, because the infectious disease doctors and nurses are the same people that are doing COVID-19 now, so they are very stretched. There is limited support in there, but they're still trying their best. I mean, our healthcare providers are really first class in that sense. But because of COVID-19 and the huge resource drain in the government now, we're very worried what's going to happen moving forward. Will the same level of support be available? Whatever we're getting is not enough, right? Maybe it's only 10% of what we really need, but that 10% is better than none.
Yeah.
So moving forward, what's going to happen? That's a big question mark at the moment.
I see.
Hope I've answered your question.
Yeah. Okay. All right. I mean, it's open for interpretation. I mean, we have to also see the situation. I mean, even looking at COVID-19 right now, nobody can give us a straight answer. So what more about HIV prevention, right? So, so does anyone else have any further questions they want to ask Raymond? Because I have questions ready. So if nobody's going to ask questions, I will be doing the question asking.
And I'm seeing some people that I know. I want to shout out to Damien Lee, Eliza.
Yeah.
And feel free to come online and say hello on cam.
Eliza is two floors down my office. So
hi Raymond.
Yeah, I haven't seen you for a long time, Eliza.
Yes, long time, half a year, I guess.
Yes, half a year. I've not seen him for how many years?
I think about a year now.
Yes, I'm afraid. Yeah, it's quite some time since I went to PT Foundation.
Right.
Yeah.
Eliza, would you like to ask Raymond anything, or would you like to comment or anything? By the way, for those of you who don't know, I think Eliza, you can introduce yourself, because I know who you are. I know the work you do. So maybe you can introduce everybody who you are.
Okay, I think other colleagues are also here. Okay, I'm Eliza. I'm from psychology. How I managed to know Raymond. I was volunteering for CHCC, for Community Health Care Clinic, for I think about 3 years, and we also did some research work. So that's why, I mean, I've met Raymond before, and we discussed a lot of things, how we can improve healthcare system for people in Malaysia, and how we can work with stigma, how we can actually deal with the situation when you have, we have religion things that restrict us sometimes from making very clear and, effective measures, some measures and interventions, but sometimes it's not really working well. Yeah, unfortunately, due to MCO, everything is complicated. Yeah, so even doing simple counseling work, which is supposed to be a kind of rapport, having good relationship between counselor and client, is now you're bad with mask, and it's not the same thing. Yeah, when it looks like a bit more medical counseling compared to this voluntary counseling and tested when we have a lot of psychological component. So again, Raymond, I'm not coming not because I don't like topic anymore. It's just simply, I think, we're all too busy now having stuff. So I don't really have question, except I hope the clinic is doing well, despite of the fact that I haven't been here for some time.
Yes, the clinic remained open throughout COVID, but there was a scare. So one of our staff, two of our staff actually got HIV, got COVID-19, and we had to close it for a while, sanitize the whole place. And then they got it up from outside. They didn't get it from CCC. Yeah, but that's some of the hazards that we have to deal with. But it's operating again now. But the counseling aspect has suffered at the moment. That is some service that we have to stop currently because we
Yeah.
don't have more licensed counselor on board.
So yeah, this is the reason why I'm not coming, right? Because now you have councils by demand, and I think you have enough people.
Okay, we have a question from Dr. Wu, is that right?
Yeah. Dr. Wu, yes. Yeah, so Pei Jun is asking, how can we as an individual support the HIV community? In fact, if I may latch on to that question, one of my questions, which is very in sync with what Dr. Wu is asking, is as ordinary Malaysians, right, how can let's not just talk about individuals, but let's talk about businesses. Let's talk about ordinary society to support the HIV community. What can we do in this country right now from the grassroots level? Let's not even talk about the policy, okay?
Yeah. It's the same advice that you've probably been getting around COVID-19. The first thing is to know the facts, right? There's a lot of myth and perceptions being passed around. There's a lot of information on social media and everything that are from dubious sources. So I think one has to just filter through and get what is really the information, the right information, all right? The second thing to actually, maybe I'll suggest is that to actually understand that we are all, most of us are at risk of HIV infection, right? Unless you're not having sex, all right? And unless you're not sharing needles, if you're not doing any of those two, then you're safe. But if you are already having sex, whether it's with just your husband or your wife, whoever it is, you cannot be totally sure that it's a safe sex, because you can be sure about yourself being safe, but you cannot be sure that your partner is practicing safe sex. So that's where we ask, if you treat yourself and everybody else as vulnerable to getting HIV, then you would internalize the message of HIV and do that. Once you internalize it, you take precautions for yourself. And when you are talking to your partner, there should be an open dialogue, right? Before you get married, before you have sex, and continue to have that dialogue. Open communication is so important. And because when you have open communication, then you can talk about issues around risky behavior, about agreeing to get tested, getting tested regularly, whether to go on PrEP or not. All those things will come if you have that open communication with your sex partner, whether it's your wife, boyfriend, girlfriend, or a stranger. Right? The third thing then, of course, is to, once you are the empowered individual, is for you to be an ambassador in your own circle of friends, whether it's your family, your classmates, your outside friends and social friends, to educate them. You don't have to do it in a very serious way, but you can always find out what is the right information. Every time there's something that's inaccurate or somebody make a joke out of it, you can point them out in a nice way to tell them what the information, the right information is. Right? And of course, if you are already exposed to any form of risky sex or sharing needles, then you should get yourself tested. And you can come to us, you can go online, you can even order for a test kit today to get yourself tested. Right? That's the first step, to actually, and do that regularly, because the risk doesn't happen just once, it can happen again. So you need to do regular tests. And of course, the third thing is to explore what other prevention methods that you want to use, whether it's condom, whether it's PrEP, right? And only when you're doing all of that in your life that you can think about maybe engaging your company or your organization to help out, or you yourself you want to help out, you can volunteer your services. We're always in need of services, volunteers, and we're always in need of monetary resources. So if you happen to have a lot of money with you, you want to make a donation, we're happy to receive them. Or you can do a fundraising campaign for us during World AIDS Day. You can enroll your, we can provide information or sharing session in your company, in your university. And like what we do at online today, we can do the same for any organization out there.
And I want to say thanks to you because I think over the years, this is probably the second or the third time that you have came on my, what do you call this, on my invitation to share with the community. I remember the last time when you came to share face to face with the students. You brought along a couple of your colleagues as well who were HIV positive, and they shared their personal stories. Um, if I may boldly say, actually, the personal stories are the one that really gets people attention the most. And I believe that people need to realize that these personal stories are the factors that really stick the message or drives the message back home, because it's personal, it's human. And I guess these human messages needs to come out even more. Um, yeah, so thank you very, very much for that. Dr. Wu is also asking, is there a place or a brochure that we can get the right information that we can share with our friends or family? Definitely not Dr. Google. But where does PT have that?
Yes. You can collect. We have brochures in our office, but we find brochures are very limiting today when everything is available online. So just look into our website. We also have a Facebook. We have an Instagram. Like our Facebook, like our Instagram, and you get updated information. Just our website. We have a Facebook for. We have a website for Community Healthcare Center as well as another website for PT Foundation. Both have quite a bit of information in there that you can look. And if you want more reliable sources of information that is more detailed, more academic, for example, you can look up UNAIDS, you can look up WHO, and from there will be a list of referrals for you. Right? If you doubt anything, just send me a line. I have my email address in there, and I'll be happy to answer your questions.
Dr. Han has a question on PrEP, which I am also going to add on another question after you answer. Dr. Han says he wants to try PrEP, but he doesn't have the money. Is there such a thing as free PrEP in Malaysia?
Unfortunately not. It's so frustrating because there are enough studies to show that if you invest in PrEP today, you're going to save so much of taxpayers' money later on. Because with you on PrEP, it's just a steady maintenance. If you succumb to HIV and start developing AIDS, and you need to go into ICU because you get pneumonia, you get skin cancer, you can't breathe, or you're dying, whatever, those will be added costs, and you're taking up an extra bed, extra resources in an emergency department in the ICU. If we are wise about it, you spend it on prevention, and that's going to stop the transmission rate high anymore. And therefore, if we stop the transmission rate higher, you don't get people who are positive, because when you're positive, the government has to provide free treatment for you for life. Right? If it is PrEP, all you need is to provide PrEP while you're sexually active. The moment you're no longer sexually active, you can stop taking PrEP. And when you want to be sexually active again, you resume taking PrEP. So it's a lot, but it's very cost effective. And if you want affordable PrEP, the most affordable at the moment is UMMC. At UMMC, they can provide PrEP for as low as 30 ringgit or so. But it's a government hospital. It's very cumbersome. You need to know where to go, and you have to wait a long period and everything. So most people, when they experience that, they prefer to come to us, and we give them, we prescribe it for 90 ringgit a month, which is very affordable. When we started off, we brought it down to 150 ringgit. Over the years, we wouldn't be able to bring that to 90 ringgit. So hopefully the price of that PrEP will come down sufficiently, so we can offer it even lower, or we can get funding so they can offer it. Like for students, the ones who need it most are those who are doing sex for the first time. They tend to be students and young adults, right? And they don't have a lot of money at that time. So ideally, we can get some kind of a co-sponsorship. We actually have a pay-forward policy whereby somebody who wants to pay forward for somebody else, they can do so. So that's another way to bring the cost down. So Dr. Ping, is it Dr. Who?
Dr. Han.
Dr. Han.
Yeah.
Yeah, 90 ringgit a month. That's less than 9 net Starbucks coffee in a month.
How about like prep on demand prep?
Okay, prep on demand is yes, you can actually save more money by taking prep on demand. Prep on demand, for those who might not know, is actually you don't have to take it daily, but you take 4 pills, 2 one day before sex, 1 on the day that you have sex, second one on the next day. So within those days, you take it, and that sexual episode that you have should be safe and protected. But because sex often happens unexpectedly, you can't plan for it.
Yep.
So that might not be that, but you may be taking risks, unnecessary risks. And secondly, is that if you're taking it in that basis, you are likely to forget.
Right.
But if you're taking it daily at a certain time, it like vitamins, you won't forget. So for those reasons, we actually recommend daily prep rather than prep on demand. But that's available, and you can actually come to a CACC, talk to the doctor, and they will assess your whether you need it first of all, and then if you want prep on demand, you can tell them, and they might discuss with you and see whether that's something that you are disciplined enough or to do. Yeah, so the doctor will be the doctor, and our frontline staff should be able to advise you on that.
Damien just said a quick advert. FHDA in Penang is offering prep at 68 per month, and which is not including.
2 ringgit.
Yeah,
32 ringgit cheaper.
32 ringgit cheaper.
Yeah.
You promised on Facebook that you were going to get a lot of difficult questions, right? So here comes the difficult question from me.
Oh, not yet, you mean?
Not yet. Because Raymond, picking up on PrEP and also picking up on what you said about the government is subsidizing the HIV medicine for people living with HIV. So 2 difficult questions that I'm going to pose to you. The first question is about PrEP. A lot of the young people today, they see PrEP, those that know PrEP, right? They see PrEP as a shield against contracting HIV. Now, what are your thoughts about that kind of thinking, and will it lead to an unnecessary, I would say, moral debate about promiscuous sex especially among the community, especially among the young kids? And when I say young kids, I'm not just talking about the guys, I'm also talking about the girls as well, because they see that there's this thing called PrEP. They think that it's a shield. So what are your thoughts about this, and does that mean the end of condom usage?
Okay, again, there's many layered questions in there.
Yeah.
First of all, we are not here to tell you what your moral values would be. That's for you to decide for yourself what your moral values are. And of course, that can change over time as you know more about yourself and the information available, that sort of thing.
Right.
But whatever you do, you have to assess it against your own moral value. What we are providing is based on our work on the ground and the training that we've been getting and the studies that we have come across. We practice basically evidence-based programming, right? And we know from the evidence that PrEP works to prevent HIV infection. It works almost all the time. The only time it doesn't work is when there are human error or there's a window period. So within all that you succumb to HIV. But by and large, PrEP works against HIV, right? But will it actually encourage risky behavior and more promiscuous sex, everything? Again, we look at the evidence, and there are studies that have shown that people who take PrEP do not end up having more sex. or more sexual partners. They show that maybe in the first 6 months that happens. There is a Malaysian study that actually shows that as well, that Korea UMC has conducted. It shows that people go back to the same level. In fact, some of them show less sex, less number of partners, or same number of partners as before. So that's clear evidence that it doesn't lead to more promiscuity or more sexual partner or more risky behavior. The other component that you mentioned is like, so the risky behavior comes about because people say, oh, then will not, if you are using a PrEP, people will not use condom, and therefore they might get other infections like STI, like gonorrhea, chlamydia. So condoms are an effective prevention barrier for STIs like gonorrhea and chlamydia.
Right.
But PrEP only protects you on HIV. If you are really concerned about STIs as well, then you should use the double barrier, PrEP and condom, right? But if you do get STIs are treatable. That's the thing here. Whereas if you get HIV is for life. So which one would you rather get, right? So you have to weigh out the balance yourself, what is your options based on that one, right? But again, we go back to evidence that we do not see if we take PrEP, suddenly there is a rise in STI in the country, in the population. That hasn't happened in any of the countries that have done that. The evidence doesn't support that.
Good. Thanks for saying that, especially the part about condoms is still important to protect yourself against STI, whereas PrEP is only HIV. And then you did mention about the double barrier, the double protection, and that is good.
There is also that the studies have also shown that people that have been using condoms have no problem using condoms, so continue to use condoms. I am a prime example. There's a generation whereby I started using condoms at the time because HIV was so prevalent. I used condoms and I've never had any problems with condoms, and I continue to use that. And that's the same with most people. But we also recognize that at any time, even 20 years, 10 years ago and everything, we know there will be a segment of people whereby condoms is not the preferred choice.
Right.
They feel that condoms is a barrier for them in terms of intimacy, in terms of enjoyment, or that you have to plan for it. You know, condoms. If you have sex suddenly and you don't have a condom with you, you're taking the risk. So therefore, PrEP has some advantages that condom do not have. So it's a personal choice.
I guess at the end of the day, it's about the messaging and what message is it, how the message is being framed to the key affected populations that we need to talk about. Dr. Wu also mentioned that she suspects that people on PrEP have a certain mindset in terms of when they're concerned with their health. You know, they're not taking PrEP just because they want to have sex, but they're taking PrEP because they just want to be safe. It's like kind of like taking a COVID-19 vaccine or sort of a thing.
So a bit of a caution here is that PrEP, at the end of the day, PrEP is a medicine.
Yes.
And you don't take medicine if you don't need it. Right?
Good.
So one of the things that we would do if you come to our clinic, as any responsible clinic should do, is to assess whether you need PrEP. So if you are already using condoms all the time, with no problem, and you continue to use condoms, we might ask you, so why do you need PrEP? You know? Why do you introduce another? Because every medication, no matter how safe they are, has some side effects, short-term, long-term. And the same goes with PrEP. There are some side effects. So, but the side effects are so tolerable that it doesn't affect your long-term health, right? But my own philosophy is better no medicine than medicine if you don't need it. And that's the kind of approach that we use at CACC as well.
Somebody actually told me that taking PrEP can increase your cholesterol level.
Yes, I think there are some elements to that. But the main thing that PrEP does is increase the creatinine level in your kidney,
Yes.
and that can lead to complications.
Mm.
So that's the other procedure that we, so PrEP, because it's a medication, you don't just go off the shelf and buy it.
Mm-hmm.
We do the tests for you, including the kidney function test, and only when all that is well, that we provided a PrEP. And not only that, we'll ask you to come back 1 month later so that we can actually assess you again. And once you're stable, then you come back every 3 months, every 6 months.
Okay.
When you come back, but we keep insisting. So if you haven't come back for more than 6 months, we ask that you come back again to see the doctor to do all your levels, and we encourage you to do your STI test as well to see that they're all okay before you continue to take PrEP.
Yeah.
So it's all done very responsibly.
Yeah, yeah. So I got one last question, but before that, just a shout out to Dr. Wu and Eliza, because I'm also doing one project under the Sustainable Research Cluster on the social marketing messaging on HIV, and I think we should talk to each other soon and sit down and see how we can find the intersection between our projects and see what we can do out of that. And Dr. Wu thanks you for all this good information. She says she's learned a lot of new insights, and we should have one session for students particularly. Now, here's one last very difficult question that I think a lot of Malaysian taxpayers are on hinge, because you did mention that when it came to HIV medication, these are free, right? The first line medication, not the second line. I'm talking about the first line medication. These are free. Now, obviously, we know where all the money comes from, right? And Malaysian taxpayers are saying, why must we pay for another person's recklessness? What do you say to that?
That's easy.
Oh, easier. Okay, go ahead.
First of all, if you take a public health approach, prevention is always better than treatment. And again, there are many studies that shows that if the public health system provides prevention, sorry, I'm not talking about PrEP yet. I'm talking about, so treatment is also prevention now, right?
Right.
Because when you treat somebody, you are not just treating them, but you're making sure that they no longer transmit the infection to somebody else.
Right.
Right. So
Right.
in the long term, if every positive person is on treatment, it will stop transmission effectively. And that's what the Ministry of Health public health campaign is all about. And if they can stop transmission altogether, then it will save taxpayers money in the long term. There are actually charts that the Ministry of Health has shown to show that by providing free treatment, how much the government is saving taxpayers money as a result of that. Right. The second thing that I wanted to say was that I lost my train of thought here.
PrEP, something to do with PrEP, right?
No, you're saying that why should the government pay for that, right?
Not the government,
so basically
but
it's
yeah.
cost savings to the government.
Yeah,
it's cost savings to the government and the taxpayer. Yeah.
I think about second line treatment. You have to pay for the
Say that again.
Pay for the
Second line.
line treatment.
Okay, so so that's the real reason why if you keep it free, it makes sense. So just a quick explanation. Most people just need to do the first line of HIV medication because if you continue to take it every day, then the drug works for you, you take it for life. But the problem is that when some people stop taking it and then they start taking again, your body gets immune to the first line of treatment, you have to take the second line. So sometimes that happens because of some personal crisis in their life, whatever. But when it happens, in the past, up to now, you have to pay one medication because when they give you drugs, there are 3 different drugs they give you. The government will pay 2 and you pay 1. And then if that happens to default again and you got immune to it again, there's a third line. At the third line, you pay everything because in a way you are at fault. But obviously it's because if your body just got immune to it by itself through some chemical reaction in the body, then the government is still provided for free, right? So that's mine, but first line, second line, third line. So the whole purpose of our public health HIV campaign is to keep you on first line, so you don't have to go on second line.
I see, and that's why early testing, regular testing and early detection is very important, because once your what count your what count do we call it again? Oh gosh, Raymond. Your CD4 count, yes. Once your CD4 count drops to below 200, then you're at dangerous level already. It's already bordering on AIDS level already. Yeah? And for those of you who do not know, there is a very big difference between HIV positive and AIDS. Very big difference, right?
Yeah. More so than so again, the analogy is COVID-19. People always use the word COVID-19, but what they actually mean is the virus, right?
Yes.
The virus is what causes CORV.
SARS something.
Yeah. But in COVID, it doesn't matter, because when you get the virus, you automatically will go into COVID-19. Even though it's the symptoms are mild or undetectable, you go, because that's what it leads to. But the HIV is different, right? Because if you get HIV positive, I know of friends of mine who remained positive for 18 years before they needed treatment. These are the old days, right? So after 18 years, because she looked after herself, everything only after 18 years. But today, they give you treatment immediately if you're diagnosed, because it's proven to work better that way now. But I want to come back to you. I know what I was going to say just now about why should you give treatment free to people HIV positive.
Yes.
The analogy is very simple. Why do so people who get lung cancer and all that, right?
Yep.
Most of them is because of smoking.
Right.
People who get liver cancer, most of them are because of drinking, right? So when people come to present themselves with cancer, liver cancer or lung cancer, and we know it's because of smoking or drinking, would you then say to them, "Padan buka you should, because of what you did, you shouldn't be able to get government treatment for your cancer and all those other things." Similarly, if you are diabetic, most diabetic people acquired it because of the rampant abuse of taking sugar in the body. To the point they say that the insulin levels drop, and then they get diabetic, right? So same thing here. Why should you continue to? Why should we treat you for diabetic? Because you bring yourself by taking so much sugar content, in your life.
True.
So if you go on that, you don't need public health anymore, right?
Yeah.
So the whole purpose of public health is to treat everyone equally.
Yes, I agree. I totally agree.
Don't forget also that many people who get HIV, it's not through fault of their own.
Yeah.
It's through a wife who's totally monogamous can be HIV positive because of the husband.
Yep.
Right?
Yep. Thank you so much for that, Raymond. I mean, I keep telling people whenever I talk to people, look, HIV is not a disease, it's a condition. It's just like it's a condition just like being diabetic. It's just a condition like being other things as well. It's not a disease. And that messaging and that narrative needs to continue to go out there. And I believe that as academics, as responsible people, I think everybody who's here, anybody who's listening, we've got to play our role in shaping or continue to shape that narrative, especially among our young people. For the old ones who cannot teach them new tricks, really forget about it, just start shaping the younger ones. Thank you so much, Raymond. Is there any last things you want to say before we finish and call it a night? We really went over time this time.
Yeah. I'm conscious that we're supposed to an hour, it's actually an hour and a half.
Yeah.
It's about an hour and a half.
Yeah.
So for those who are still listening, really thankful that you're still there.
Yeah. Thank you so much. Yeah. Any last minute things you want to say, Raymond?
No, just help us to do our work, help us to help the community, help us fight stigma, discrimination. That's what World AIDS Day tagline today is, this year, which is end inequality and AIDS.
Wow,
so
okay.
The way to end AIDS is the end inequality.
Inequality.
In every aspect of our lives, and inequality.
Yes. So Raymond, I think Dr. Wu, myself, and probably Eliza, we're going to get together and have tea and talk more. And we are probably going to be reaching out to you very, very soon to see what we can do to bring the message and also to keep pushing the narrative forward lah, in every sense of the word lah. Okay, there are many other things that we cannot cover today. I actually wanted to cover something on employment. I actually wanted to cover something on how to deal with family members and all that, taking care of family members. But I guess we will wait for another time for all these things for us to talk about. Yeah. So thank you so much, everybody. Please give a virtual clap to Raymond. Raymond, if you can stay online, I would like to have a quick chat with you. Yeah. So thank you, everybody. Take care and happy World AIDS Day. Remember, please stop the inequality. Yeah. If you want to stop the HIV infection. Thank you, everybody.
Thank you.
Take care. Bye.
Bye, Raymond. Bye, Derek.
Bye. Thank you. Thank you.
Bye, Derek.
Thank you.
Bye.
Okay, we're just waiting for everyone to leave. Oh, wow, everybody left so fast. Hey, Raymond, thanks so much, man. Yeah, Raymond, thanks very much. I think I don't think it's the number of people. I think it's the quality of the discussion that came in. I think that was more important. The idea that you mentioned about, you know what, I didn't even know about the 58%. I'm quite appalled by the 58%. When you showed the 58%, I'm very, very appalled by it.
Yeah, but the problem about, I mean, you have to look